for those companies that provide the insurance, they will have tax incentives on payroll tax incentives will be developed. Now, the other thing too is that for those companies that do not provide insurance, although it's mandatory, for those companies that do not provide insurance, they will be taxed. Right now, they're saying $2,000 per employee. So in other words, if you're Mr. Employer and I have a company that's 50 plus people, and I decide that I still don't want to do the insurance, or I just say, well, you know what, I'm not going to do it, then what that means to me is that on an annual basis, I will be billed by the federal government $2,000 per employee. You know, the other thing too is that those companies that consist of 2 to 50 employees, the way they're going to benefit is that they're going to benefit in a tax situation. In other words, they'll be able to deduct, I don't know the exact amount in regards to percentage-wise, but they will be able to in fact deduct those premiums that they pay from their payroll taxes. So that would be the primary incentive. Now, the other thing is, though, is that although it's not mandatory that those companies provide insurance, it's still mandatory to us as individuals that we still have to go out and purchase insurance. So if we're working for a company, and in fact, if we're working for a small company, that doesn't necessarily say that we don't have to get insurance. We still have to get insurance. We still have to show that we have insurance coverage. If you currently work for a company and they are in the private sector and they currently provide insurance, whether it be Humana, Blue Cross, Prudential, Cigna, nothing will change. Everything will be the exact same. And I think that's one of the things that the president had told us, that for the most part, most individuals will not be affected by this. The only people that are going to be affected by it are the people that currently don't have any insurance because of pre-existing conditions, or because of their age, if they're 24, 26, and they can no longer be on their parents' insurance. Those are the people that are really going to be affected by it, because with the healthcare reform law, now it says that I can still have coverage through my parents' insurance up to the age of 26, whether I'm a full-time student or not. The other thing is that the key component here too is right now insurance companies can, I don't really want to say discriminate, but insurance companies can underwrite based upon medical conditions, and now they can.
There's a significant number of people that are unemployed right now. They may have been unemployed for a few years, and they don't have insurance. What about them?
Now, those people will actually be eligible for Medicaid. Those people will be available for Medicaid because they show no income. So, I mean, they will be eligible for Medicaid. I mean, they also have an option of the healthcare exchange, but obviously the healthcare exchange, there's going to be some cost involved. So for those individuals that are unemployed, have no source of income whatsoever, my best suggestion would be that the person look into Medicaid. And obviously for those people that are 65 years old, you know, they have to look into Medicare. The name of the company is Benefit Management Associates. We have a website available. The website is www.benefitmngt.com. Primarily what we do is that we service any corporations between 2 and 500 employees looking for employee benefit packages. And primarily what we do is that we come in and we become the actual insurance department for those particular companies. We work with some companies that are small and they cannot afford or even have a person to be full-time insurance. So primarily what we do is that we come in and take that insurance department hat and kind of wear it for that company.
And if you have an issue you'd like for us to cover, reach out to us at contact@blackamericatalks.tv.